everyone. This class we will learn other therapy. I'm Dr. Liu, come from Department of Traditional Chinese Medicine, the first affiliated hospital of China Medical University. The contents of this part include 3H needle therapy and point injection therapy. First, 3H needle therapy. The 3H needle therapy is a method of puncturing the selected site to bleed with a 3H needle to treat disease, known as puncturing collaterals in the ancient times and the bleeding therapy nowadays. The 3H needle developed from the sharp needle of 9 needles created in the ancient times, presently made of stainless steel. Being 6 cm long, is shaped in a round handle, triangular edges, and a sharp tip. It is often used for puncturing collateral to bleed. H needle therapy has the function of circulating the materials and the collaterals, opening the orifice, reducing heat, dispersing the swelling, and relieving pain. It is advisable to treat pain and excess syndrome, heat syndrome, blood stasis, pain syndrome, and so on. It is also applied to some acute or chronic disease such as coma, high fever, syncope, sore throat, hemorrhoids, numbness, and so on. Hold the handle of 3H needle with thumb and the index finger of right hand, the middle finger supporting against the lower part of the needle with 3 to 5 mm of the tip exposed. There are 4 commonly applied methods: point pricking, scattered pricking, collateral pricking, and pricking needling. First, point pricking. Before puncturing, push and press the skin around the selected place to gather the blood. Hold the handle of the 3H needle with right hand. Prick the disinfected place quickly, about 3 to 5 mm deep for bleed letting, and withdraw the needle. Squeeze the skin around the pricked place to let a few drops blood out, and then press the punctured point with a sterilized cotton ball to stop bleeding. This technique is often applied for tips of ears, fingers, and toes. Second, scattered pricking. It is a technique of prick a number of spots at the disease location. Based on the size of disease location, 10 to 20 spots should be pricked narrowly from the center of the outside in order to disperse the blood stasis and edema. Third, collateral pricking. After disinfection the skin, prick the selected superficial vein to let a little blood. Afterwards, press the punctured hole and with a sterilized dry cotton ball to stop bleeding. It is for acute vomiting and diarrhea. Last, pricking needling. In the operation, with the left hand pressing the sterilized skin, the right hand pricks superficial the skin about 1 to 2 mm deep with a 3H needle to let the blood and the fluid. Or further prick 0.5 cm deep to break the tissue fiber, and then cover the site with sterilized gauze. This technique is applied for painful shoulder, stomachache, neck pain, insomnia, asthma, and headache. The 3H needle therapy is a strong stimulation. Fainting should be prevented, particularly for those receiving the initial treatment with therapy. Expected manipulation is required for prevent infection. For spot printing, operation should be slight, stable, correct, rapid, and avoid excessive bleeding. Printing should not apply to weak constitution pregnancy and bleed tendency. Part 2. Point injection therapy. Point injection therapy is a method that drug injection is used in points or relevant locations, exerting a stimulative effect on the point through the puncture and the drug injection. This method can improve physiological functions and therapeutic effects. The majority of disease indicated by acupuncture can be treated by point injection. It is suitable for cough, asthma, nervous pain, lumbago, B syndrome, and skin syndrome, and so on. The size of the syringe needle and the syringe used in treatment vary with drug in dosage and the selected location. In general, 1 mm, 2 mm, 5 mm, 10 mm, 20 mm syringes are adopted. The selection of points based on the differentiation of syndrome, select 2 to 4 relevant points or Ashi points as locations for injection. The dosage in point injection depends on the location of injection, the proper and the density of the injection. The locations on forelaps, waist, buttocks, where the muscles are abundant, can be injected with a little more dosage, and those points at head, face, and auricles, muscles are thin, may injected with 0.1 to 0.5 mm per point. In the treatment, draw the injection into the syringe. Sterilize the place to be injected on the patient, who is on a proper position for the injection. Puncture rapidly the syringe held in the right hand in the point. Then the needle is generally inserted deeper. Pay attention to the blood. Point injection is applied once or twice a day for acute disease and once a day or every other day for chronic disease. One course consists of 6 to 10 parts of treatment. Duration between two courses is 3 to 5 days. The drug for muscle injection can be adopted in point injection, such as the herbal injection and the Western drug injection, include vitamin B, vitamin C, and so on. The normal reaction of point injection should be clearly explained to the patient. Generally, there is a sensation of distending soreness in the local injected area, may last for 48 hours or less. In addition, pay close attention to avoid the vessels and the nerves during the injection. To avoid the infection, aseptic manipulation in point injection is required. To prevent abortion in general for the low abdomen as well as the point 合谷 or 三阴交, point injection is not applied in pregnancy. Conclusion: the 3H needle therapy and the point injection therapy are commonly used in clinic. Pay attention to the indications and occurring indications during the clinical application. the invasive operation should pay attention to the concept of sterility to avoid infection. Okay, that's all what I teach today. Thank you for your attention. Bye.